Mbale Regional Referral Hospital, and one of the main problems that we have in this hospital is overcrowding, especially in the Department of Pediatrics. And the reasons for the overcrowding, one, are that the population is big. Mbale Hospital covers a population of 16 districts. And the second thing is that majority of the patients are referred here because of severe anemia, meaning that there's not enough blood. And one of the main causes of severe malaria is actually malaria. So it means we are not doing enough to prevent malaria. But also the other thing is that we are not doing enough to have the adequate nutrition, to have enough blood in our bodies, such that when malaria gets to the child just ends up becoming what? Anemic. The other thing is that it makes us realize that the community aspect of prevention is actually poor, because why would so many people be getting malaria, anemia at the same time? Now, the other thing is that in this region, especially the Bukedi region, there is a high prevalence of sickle cell disease. And because of that high burden of sickle cell disease, you find that many children actually end up becoming anemic, and then they are referred to Mbale Hospital. And the other thing is that patients in this region usually come with very many attendants. So that is also one of the causes of crowding. And then, of course, the poor referral systems, because some of these children can actually be very well handled in the district hospitals, the health center 4s, and even health center 3s. But somehow they find themselves here, and it is difficult for you to turn away a patient who has already come here. Then, of course, the wards are also very small, like you've seen. They are small, because you can imagine having a 2-month-old baby sleeping in the same room with a 14-year-old, and you know, it's not acceptable. Ideally, there should be enough space so that we separate into age categories, or maybe disease conditions or something like that. Was started and stopped, and when you start and stop, then the malaria goes up. So from last year in May up to this year, we have been seeing just increasing numbers of malaria cases, meaning that the prevention component is not working very well. And it's mainly in the Bukedi region. The Bukedi region is where there is Budaka, Palisa, Butebo, Butaleja, Tororo. Those are the most hit. And then in the Bugisu region, Manafa and Namisindwa are the most hit.